Good morning, everybody, and good morning, all DPCN members. You're very welcome to a conversation this morning on the Disability Policy and Law Maze. My name's Mark O'Connor. I'm from Inclusion Ireland, and Inclusion Ireland gets a little bit of government funding to do this work through the Scheme to Support National Organisations, and that is administered by our friends in Pobble, just to acknowledge their support of the work that we do in this area. So, first thing we're going to talk about is the UN Convention on the Rights of People with Disabilities, well known as the UN CRPD. It contains 50 articles covering a wide range of life. There are articles on civil, cultural, legal, political, and economic, and also social rights. And then there are specific articles on women and children. The convention also contains 7 general comments, and they're to expand on some of the more important articles, articles that cover areas such as equality and non-discrimination, participation of disabled persons through DPOs within government structures, inclusive education, independent living, being involved within your own community, and women and girls. As most people in Ireland know, the CRPD also contains an optional protocol. But what is an optional protocol? It's an extra bit added on to a convention that addresses issues not fully covered by the convention, and a state party can then choose to sign up to that or not. The UN CRPD optional protocol, it allows for people to make a complaint to the UN. So just to give a little expansion on what the CRPD itself covers, this is just a very short video that will explain, well, not do a deep dive, but will give an indication of what the articles cover within the CRPD.
We are all equal before the law.
Women and girls with disabilities should have the full rights and freedoms enjoyed by everyone in the community.
As children with disabilities, we have the right to express our views on matters that affect us.
We are capable and contributing members of society.
We have the right to physical access and information access.
We have that right to life.
We have the right to be rescued in times of disaster.
We have the right to equal recognition before the law.
We have the right to justice.
We have the right to live freely in the community, to live independently and be included.
We must not be tortured, exploited, or abused.
We have the same rights as others to choose where we live and where we travel.
We have the right to access information and to express opinion.
We have the right to privacy and to have intimate relationships.
Our children cannot be taken away just because of our disability.
We have the right to education, jobs, and healthcare.
We have the right to participate in cultural and public life.
So a wide range of articles covering a wide range of rights. So the CRPD status in Ireland, Ireland signed the convention very early on in 2007, but it took until 2018 to ratify it. Don't let the fact that it's ratified let you think that it's fully incorporated into Irish law. It isn't. Ireland is a dualist state, so at some point we'll need to ratify a UN CRPD, we need to pass a UN CRPD Act. And then, you just have to look around you. For example, the Assisted Decision Making Act is not fully commenced as yet. State engagement with disabled persons organisations is on a pretty low base, if even existent, and there's very little funding for any DPOs. And then there's also issues around deprivation of liberty, and legislation is required there. The optional protocol, it wasn't ratified at the same time as the rest of the convention, but the programme for government does tell us that it is due to be ratified after the first state reporting cycle to the UN. So moving on, the National Disability Inclusion Strategy. Now, that's an Irish strategy, and it's Ireland's attempt, I suppose, to get in line with the CRPD. The National Disability Inclusion Strategy, it has 8 themes, and those themes are equality and choice, joined up policies and services, education, employment, health and well-being, person-centred services, transport and access, and living in the community. So wide-ranging themes, and a lot of what's in the UN Convention fits in under those various themes. It's due to run till 2021. So that means that a new one will be coming along soon enough, and it's certainly going to be needed because a lot of the 114 actions that are under the 8 themes, that involve multiple government departments, have not been carried out fully as of yet. We mentioned a couple earlier, for example, the Assisted Decision Making Act, I think, was meant to be fully operational by 2017, and that hasn't happened. And it's also silent on some of the not fully commenced laws of the original National Disability Strategy. I'll talk about those a little bit in a moment or two, and those laws are the Disability Act, the Education of Persons with Special Education Needs Act, and the Citizens Information Act. They're not fully commenced as yet. So the NDIS, it has a main steering group, and it is chaired by the Minister Rabbitte, previously Minister Finney McGrath, and among the members of that steering group are the DSG. The DSG is the Disability Stakeholders Group. It's made up of disabled persons and representative organisations, amongst others. And just to note that there's a consultative committee in each relevant department. One of the big ticket items that comes in under the inclusion strategy is the comprehensive employment strategy, and that is to run for 10 years up to 2024. Again, you can click on the link there if you want to find out more about the targets and aspirations of it. So there's 6 main strategic priorities and over 80 commitments contained within the strategy. I would just point out, just look at the lead minister. At the time, there was no minister willing to take on the comprehensive employment strategy. You would have thought the Minister for Social Protection or the Minister for Business and Job Creation, or whatever that department was called at the time, would be the ideal minister, but it was left to Aon O'Riordan, who was a junior Minister for Equality and drug strategies. So it gives you an idea of how serious it was taken at the time. One of the big ticket items in it is to increase the public service numbers of disabled persons, disabled employees, from 3 to 6%, and to ensure that that happens, have alternative recruitment channels, an independent implementation group, and a helpline for business. They're the main themes contained within it. I'm not going to go through each one, but some of the ones that really need some work on are, for example, training within all Intrio offices, so disabled persons can go in like anyone else and get support back into employment rather than have to go to specialist pieces. Some of the skills building and capacity and independence stuff has been done, but it's only been piloted through ability programs, and even their funding mechanism is unstable. It's time limited, and one of the criticisms of that is that the really good work that goes on in there is quite often not brought into mainstream services to be worked upon. Just a quick dip into the HSE. Now, we don't want to medicalise this problem, but a lot of disabled persons interact with the HSE around services that support them in their lives. So just to give a quick nod to them and where they're at. starting at the beginning, progressing disability services for children and young people, which is quite a mouthful, is a move from it's a move from condition-specific services to a more location model, where all children can access children's therapy services on an equitable basis. So what does it mean? Like, if I was to think back a number of years ago when my son would have been accessing these services in County Louth, he was a young autistic child, but the autism services were quite poor, but at the same time, there was a reasonably good intellectual disability service. So what happens now is services that are there, they don't serve a specific population. They're taken together and they form a children's network disability team to serve all children in an area, regardless of whether they have an intellectual disability or physical or sensory impairment. So whatever the case may be. New Directions, as the reform of Disability Day service, it's centred around 12 supports such as person-centeredness, routes into education, employment, being able to move on. And, you know, we know from when the report was originally done, some of the services were doing really, really good work and some of them not so good. If you click on the link, there's a really, really good video there that explains New Directions and what you should expect as a disabled person if you are linking in with a day service. Time to move on from congregated settings. That's the move from institutional settings to homes in the community. It's one that's well behind schedule. It should have been completed by now. And again, it doesn't include all institutional settings. So, for example, the likes of the Camp Hills and some of the large autism specific places and some of the private providers, they would meet the definition of a congregated setting, but they're not included in the figures of people to be moved out. Finally, personal budgets is a current reform piece. There's a demonstration project going on in the HSE. And what is a personal budget? Well, instead of somebody going to a service provider to get a service, they get an equivalent budget to then go and set about supporting themselves in a way that they would like to be supported. They get to pick their own staff and all of that kind of thing. The downside of it is it's a lot of hard work to set it up. The plus side is you get to live the life of your choosing, not of a service provider's choosing and what they can offer. So it's you know, it offers the greatest independence. Some other policy areas, I'm not going into these, I'm just mentioning them. If you want to find out a little bit more, click on those links. Sharing the vision, it's the successor to Vision for Change in terms of the reform and full staffing of mental health services. National Neuro Rehabilitative Strategy is also there for folks that acquire brain injury and so forth. Sláinte Care, it's the full transformation of health and social care towards community-based services away from the more acute models. Again, there's a great video in that link that will explain it very simply and very easily. Housing for All includes recommendations. This is the housing policy that was launched just last week. It includes a number of recommendations for disabled people, but we're waiting on the specific strategy, which we'll allude to in a few moments. And then another policy area that you might consider looking at or might be of interest to you is safeguarding of vulnerable adults at risk of abuse. And it's not my definition, but disabled persons fit within the definition that is there of vulnerable persons. So we're just going to take a little bit of that. That's most of the main policy areas. We will give a nod to one or two that are coming up. Now it's just to look at some of the law. It's worth noting that some of the laws, and James Cawley from ILMI will speak on how you can use this legislation in our next session, but this is just to give a nod to some of the laws that are out there that disabled people can use to ensure their rights are upheld. I just want to point out that most of the laws that are of most benefit to people, they're not disability specific laws. So we'll just take a little trip. And the first one is Section 42 of the Irish Human Rights and Equality Commission Act. And again, luckily enough, we have a nice short video on this.
People in Ireland rely on services provided by public bodies on behalf of the state every day. From colleges and hospitals to libraries and the courts, these services are essential, and it is important that they can be used by everyone. The public sector equality and human rights duty is a legal obligation on you as a public body to eliminate discrimination, promote equality of opportunity, and protect the human rights of your staff and the people who use your services when carrying out your daily work. It's a positive obligation that requires you to be proactive, to think about human rights and equality issues in your work and address them before they become a problem. The duty applies to the whole organisation, including corporate services, procurement, human resources, service provision, research, policy and regulatory functions. To meet the core requirements of the duty, you must assess, address and report. First, assess. You must carry out an assessment of the human rights and equality issues relevant to your work. This assessment must form a part of your strategic or corporate plan, which should be accessible to the public. The assessment should be based on evidence. Input from staff and people who use your services is key, as is using internal and external sources of information and data. Remember that equality does not always mean treating everyone the same. It is about considering the particular needs of people so that similar outcomes can be achieved. Certain people or groups of people may be more at risk than others of experiencing discrimination or human rights violations, and careful consideration must be given to include these concerns. Secondly, address. You must set out in your strategic or corporate plan the policies, plans and actions to address any issues raised in the assessment. You can include actions you may have set out under different national strategies or policies, or under the public sector reform programme that are related to equality and human rights. You will need to think about positive actions you can take to meet the needs of people at risk and consider reasonable accommodation for people with disabilities. Finally, report. You must report annually on progress and achievements in a manner accessible to the public, such as your annual report. Integrating the duty into your strategic plan and annual report means that it is an ongoing obligation that must be monitored, reviewed and developed in each strategic planning cycle. The duty has the potential to positively transform how public bodies engage with members of the public and their own staff, to make Ireland's public services more inclusive and more effective, and to achieve an Irish society where everyone and their rights are treated with respect. The Irish Human Rights and Equality Commission has produced a guidance for public bodies on implementing the duty. You can access this guidance and learn more at ihrec.ie.
Just to say a little bit on the public sector duty, I know there's a number of disability service providers that are part of the DPC network. Just to let you know that Inclusion Ireland has an easy read guide to the duty and an easy read checklist that if you want to go and check a local public service against the duty, it's there. And there's also some training materials. So if you're looking to build capacity with people, there's good information there on inclusionireland.ie. Next piece of legislation, the Disability Act. I'm going to imagine most of us have heard of it. It's been around since 2005. So what does it include? It includes an assessment of need, assessment of somebody's health needs that are caused by a disability that they have. And that assessment is currently only available to people born after June 2002. You will now note that that obviously includes some young adults, and there is a bit of talk on whether once any adult is included, should all adults be included? So I can't answer that. You might need a legal person, but anyway, it's for folks that are after June 2002 at the moment. Just be mindful. An assessment is an assessment. It doesn't necessarily mean you're going to get the services provided to you that are identified within the assessment. It also includes provisions around access to buildings and services, and some named departments have to develop what they called at the time a sectoral plan, and that's something that's fallen by the wayside. There were original sectoral plans and not so much now. It also includes, as we mentioned earlier on, in the Comprehensive Employment Strategy, public service employment for disabled people. And finally, it includes the Centre for Excellence in Universal Design, and that's currently housed over at the National Disability Authority. And they've produced universal design for housing and accessible reading materials and communications, and all of that kind of stuff. Again, look, Disability Act, it's there, not fully commenced as yet. The second legislative pillar of the original National Disability Strategy, the Disability Act, was the first. Second one was the Education of Persons with Special Education Needs Act. And so what does that do? It puts inclusive education on a statutory footing, but just be mindful, it's not in line with the UN Convention on the Rights of People with Disabilities vision of inclusive education, because it gives government and schools an opt-out. If they believe a person's needs are so great, they don't have to admit them to inclusive education, which is not in line with the convention, which doesn't allow for any omissions. Also, it provides for assessments and the associated supports to access education, and an appeals mechanism if you don't think that you've been treated fairly in that process. That's the beating heart of the Act. That's the part that hasn't been commenced. So at the minute, you cannot get an assessment and then the needs identified met to allow you to access education. It also established the National Council for Special Education and all of their functions. But I would say to people, well, the EPSN Act has never been fully commenced. There are other pieces of legislation there that are of interest to disabled persons, or the parents of children attending school more so. So there's the Education Act of 1998. It has lots of provisions around providing support to children with special education needs, to call them in the Act. And it also has a provision where if a child is expelled or suspended from school, that they can appeal against that. And that's an independent appeal. The Education and Welfare Act, that provides, again, for some policies and procedures around suspension and expulsion, and that schools have to follow them. So, you may have scope in there for redress. And there's also the Education Admissions to Schools Act, which has some provisions that gets the minister to open autism classes or other specialist classes. Again, they're not in line with the CRPD because they're segregated provision, but they're provided for within the Act of 2018. Citizens Information Act, look, the main piece of the Act that concerns disabled persons is the establishment of a statutory advocacy service, the Personal Advocacy Service. That area of the Act hasn't been commenced. But what we do have is we have the National Advocacy Service for people with disabilities. Click on the link there, you'll find out a lot more about them. They operate according to the Act, but they don't have statutory powers. So what do we mean by statutory powers? They don't have the absolute legal right to go in and get records on a certain person they're representing, and a provider of services or whomever they're advocating with don't necessarily have to meet or engage with them. Now, most do, but legally they don't. So the NAS, they operate a free independent advocacy service for adults with disabilities in Ireland. So if you've ever got an issue, contact them if you require some support around that. Just note, there is no national advocacy service for disabled children or for their parents at present in Ireland. The Equal Status Acts, like I said earlier on, it's not disability specific, but disability is one of the grounds upon which you can take action under the Equal Status Acts. So I'll just play a short video that will introduce us to the Equal Status Acts.
Know your rights so you can stand up to discrimination. A guide to the Equal Status Acts. The Equal Status Acts ban discrimination in certain situations. When buying products, or when using services like public services, transport, financial services, or education. Did you know? It's illegal to treat someone less favourably because of their gender, civil status, sexual orientation, religion, age, race, or because they are a parent, pregnant, a carer, a member of the travelling community, or a person with a disability. In relation to accommodation, it's illegal to discriminate against someone because they are receiving a social welfare payment. If you feel you have experienced discrimination, the Equal Status Acts can help. Go to ihrec.ie for more information on your rights under equality law.
That was the Equal Status Act, and that's just an introduction to them. And I think next week, James will be explaining a little bit more on how you can use some of these acts to pursue your rights as a disabled person. One last one to look at is the Criminal Law Sexual Offences Act of 2017. So it removes some of the provisions of the 1993 Act and introduces the idea of a protected person. So what was wrong with the 1993 Act? While it set out to protect people with what they call impaired capacity, what it actually did was it quite often banned loving relationships between disabled persons whose capacity might be called into question. And it didn't offer full protection. It only protected the person against certain specific acts. And there are some infamous cases around that, but I'll leave you to Google that yourself. So the 2017 Act. So it's essentially a crime to engage in a sexual act with a protected person who, and the protected person this is, does not have the capacity to consent to a sexual act, does not have the capacity to understand the consequences of the sexual act, does not have the capacity to evaluate information to engage in an act or not, and is not able to communicate their consent. So a bit of an improvement on the 1993 Act, but still, when we think about groups of protected persons, when you start grouping people together, it's often not the best, and it should be a little bit more on the individualized end of things. So some of the imminent policy and law areas that are on the way, there's a national housing strategy for disabled people, and that's due by the end of this year. And indeed, next week and the week after, the DPCN is being consulted by the Housing Agency on their initial draft. So if you've got an interest in housing, get in there quick and have your say. Just as well, there's policy advice on an inclusive education system that's already long overdue from the National Council for Special Education. Keep an eye out for that, because a lot of what's there at the moment is not inclusive. There are thousands of segregated classes and hundreds of segregated schools that would not be in line with the CRPD. So that's one to keep an eye on. The Decision Support Service, which is going to see the Assisted Decision Making Act come to life. That's due in mid-2022, and there's a lot of work going on there in the background. So it does look like they're actually going to have that service up and running, and the Act commenced in that period. And we also know the Disability Miscellaneous Provisions Bill. I think that originally came around in 2017, and it's disappeared off the radar. What is it? So I suppose it's a little bit of a catch-all bill in that it's trying to tie up a lot of loose ends that aren't legislated for in the UN Convention on the Rights of People with Disabilities, and includes, for example, there are provisions around deprivation of liberty contained within the Act. So we've no idea when that's coming. Other laws of interest, I did say at the start around the legislation that a lot of the legislation that's useful to disabled persons is not necessarily disability specific, and that's the case here as well. So the Health Act, for example, if you've had a bad experience with a disability service provider or with a health provider or anything that's funded by the HSE, you can complain under the Health Act. It's better known as your service, your say, but it is a statutory system and it must be followed. The Health Act of 2007, that provides for HICWA and the various regulations that they have in relation to residential services. I did note just yesterday that HICWA are trending around, they're looking at developing regulation in relation to healthcare in Ireland, which includes, or home healthcare, which includes personal assistance services. And also, if you're involved in an issue, just note there are data protection acts where you can retrieve personal data if you believe, somebody's holding data that's about you and you want to know what it is. So an example of that where it could be used is we read recently about autism dossiers been held at the Department of Health. They can be accessed under data protection or indeed under the Freedom of Information Acts. Freedom of information, slightly wider scope in that you can request other things, not just personal data. Data protection, it also offers protection in that your data can only be used in certain ways. So in summary, and almost to conclude, is look, in Ireland, we've got some of the best equality and disability law and policy and equality law in the world. It's really, really good. The problem is it's not fully implemented. We've just gone through it. There are lots of laws that are not fully commenced and lots of policy areas that have dragged on for years longer than they've meant to. So what's the result? At present in Ireland, disabled persons do not have their human rights fully supported. And we can say that because of the failure to enact much legislation. Just some really good guides. If you want to find out more, as I said at the beginning, this was a whistle-stop tour. I would point you towards the Independent Living Movement Guide to Disability Law. Really, really good, very easy to read. And there's some stuff in there on how you can use some of the legislation we've spoken about. Inclusion Ireland has some easy read guides and videos, especially around the public sector duty. Citizens Information, where you will find information on literally everything we've spoken about today and much, much more. National Disability Authority has quite a bit of information in there as well. And if you've got a legal question, you could do a lot worse than contact the folks at the Centre for Disability Law and Policy in NUI Galway. They have a disability legal advice clinic that runs during semester time. And I think that is it. So I would just like to thank you all very much and take care.